Well, today we have on, representing Hoag from the Lakeside Vision Center, we have Dr. Eran Duzman. He's an ophthalmologist. Nice to have you here today.
Thanks for having me.
And we're going to talk about something that affects many people called glaucoma. I know that years ago, when someone got that, it was almost kind of a sentence that you could end up losing your sight totally. Now, however, if it's caught early, there are different procedures and different kinds of medications and things like that that can help stem that off and maybe save your vision, right?
Right, and we do have a lot of very, very good medications and surgeries that we can do. And you're right, I think the key to glaucoma is catch it early, have your annual exams with your ophthalmologist, and have somebody who has a high index of suspicion into picking up the disease and treating it.
Yeah, it's a type of disease that one may not even know that they have until they get to a certain point that maybe it's a little bit too late to at least use some of the initial types of treatments, right?
Right. So it's a very, actually one of the leading causes of blindness in the United States. It affects roughly 3 million people in the United States. Half of them probably don't even know they have it. So again, early treatment, early diagnosis is the key.
Exactly. Explain glaucoma and how it begins to start with someone, and are certain people more susceptible to it than others?
Sure. So glaucoma is a disease of the optic nerve. This is the nerve that sits in the back of the eye, and it relays the vision information from the eye to the brain, and that's where glaucoma hits. And there's a progressive loss of nerve fibers in that nerve. That nerve subserves vision, and so as the disease progresses, you can have visual loss.
Right.
How it starts, we don't really know. The causes, we don't really know. We think there's a genetic predisposition for it. So family history is extremely important. But family history, remember, goes backwards, but also forward. So some of the folks that may have glaucoma may want to have their family members tested. Glaucoma, sort of the underlying pathology is that fluid is made in the eye to nourish the eye structures, and it gets drained. And if there's any problem in the drainage mechanism, which there is in glaucoma, either with it being clogged or not regulating the pressure properly, then that's when the pressure goes a little bit high and can cause damage to the nerve.
Yeah, and again, as we were saying, that you to yourself, your vision might be great, and you do not even notice the onset of this for quite a while. You don't feel all of a sudden pressure in your eye. People might think, oh, it's like having a type of headache. You feel it in the back of your eyes or something like that. It's not.
No, you don't feel this, and this disease is called the silent blinder. And you're right, for many, many, many years into the disease, you do not have symptoms, and it's a problem. It's a problem with diagnosing patients because they don't go, and it's also a problem with having patients take their medications because they don't feel bad.
Right.
But you're right, visual acuity can stay 20/20 for a very, very long period of time. Late in the disease, people may notice that they start losing things in the periphery. They get startled by family members because they'll jump out in front of them and they can't see. And then obviously very late in the disease, they can lose vision.
So what are some of the treatments? I know there's everything from eye drops to surgical and everything in between, right?
Right. So the first step is really diagnosing the disease. And again, we look at the eye exams, we look at family histories, we look at comorbidities. Diabetics are high risk. African Americans, Asian Americans tend to be at higher risk for certain diseases. People who have had LASIK and have thin corneas are at a little bit high risk because we're having a hard time measuring their intraocular pressure.
Okay.
The big thing to know for people is that intraocular pressure may not be elevated in glaucoma. So the big misnomer is, I don't have high pressure, I don't have glaucoma. And that's really not a true statement. You have to look at the eye, you have to do some of the functional testing to see what the nerve sees and what the anatomy of the nerve is. But you're right, once we diagnose it, which is sometimes a process, treatment can include medications, and most people are very well controlled on medications. We have very safe medications, they're very easy to tolerate. People take them once a day, and they usually do very well. And then we go into laser treatment and surgical treatments. After I just told you that the pressure is not always elevated, the aim of all of these treatments is to reduce the pressure. Because we do know that people that have a certain level of pressures, when we reduce it, they do better.
Okay.
So,
And as far as getting a diagnosis, does it start with somebody going in and getting their yearly eye exam? When you folks do that basic eye exam, and I guess as one gets older, it might be a little bit more different things you're looking at.
Right.
Is that how you first detect it?
right, and again, high index of suspicion. Sometimes if certain optometrists and people who may not be trained properly misdiagnose the disease, and we see that often. But like we said before, yes, a proper eye exam, that should be an annual thing as part of your physical. We'll check everything from the front of the eye to the back of the eye. And if we have a suspicion, we will go ahead and run some of these functional testing and follow them along.
Now, you are, we talked about Lakeside Vision Center, and that's your practice, but you also work out of Newport Bay Surgery Center, right?
Right. So I am a general ophthalmologist. I do a lot of cataract surgery. I do a lot of LASIK surgery. I do a lot of glaucoma surgery, and we do operate at Newport Bay. Newport Bay is a surgery center that several of us ophthalmologists have put together, and have recently partnered with Hoag, which has been real positive for us. It's a center which a lot of people, we have several ophthalmologists that are multi-specialists. So we've got retina physicians, we've got glaucoma physicians, we've got people that deal with lids and orbit diseases. So we have access to a lot of specialties within that group.
And your practice, are you down in Newport as well?
No, I'm in Irvine.
Oh, okay.
I'm actually in Irvine and
closer.
Woodbridge. And Woodbridge. And we've been there for about 20 years and hopefully have a lot of happy patients. We do see patients of all ages, so kids all the way up to adults.
Great.
We do optometric services as well, so people need their glasses. And we actually do a lot of clinical trials, which has really been very positive for me. We can help a lot of patients that are having trouble with their medications, either affording their medications or having some kind of a problem taking a certain medication. We can offer them other avenues of treatment.
And the advances in eye care and the technology over the last 10, 12 years is just phenomenal.
They have been phenomenal, both in the pharmaceutical side and the surgical side. And going sort of back to surgical treatments, one of our really effective treatments for glaucoma is doing cataract surgery. And cataract surgery nowadays has become minimally invasive.
Yeah,
We have amazing technology. We've introduced new lasers that help us more accurately do the procedure. We have a lot of choices in what lenses to put in to help people be as spectacle independent as they can. So it's been very helpful. But sort of as an added benefit, we definitely see a pressure reduction in people who have had cataract surgery.
Great.
And that's a huge thing that we found. The other thing that's really new, and I wanted to kind of mention, is glaucoma surgery tends to be a relatively invasive surgery for the eye. But we have now started this whole new arena of something called minimally invasive glaucoma surgery. And these are little stent devices that we can implant into the eye at the time of cataract surgery. So it reduces the risk from infection, it reduces the risk of anesthesia.
These are sort of like drainage valves.
Exactly.
In very simplistic terms.
Exactly, and it just bypasses that little outflow mechanism. And on average, when we do that in conjunction with cataract surgery, at the time of cataract surgery, we can eliminate, on average, one medication.
Yeah, which is great.
Which is great, because if somebody's only taking one medicine, we can eliminate that.
Yeah, that's great.
So it's been a really nice addition to our treatment options.
So the key is getting your eyes checked.
Get your eyes checked. Yes, get your eyes checked by an ophthalmologist on a yearly basis. If you think anything is going on, please come see us. We're nice folks.
All right. And I want to give this is the number to your practice, Lakeside Vision Center. in Irvine, 949-733-2002.
That's
and very
correct.
easy, Dr. Duzman, MD. And again, you're in Woodbridge.
Correct.
So very, very close by here.
Very central. Yep.
All right. And
Okay.
your association with Hoag is great, and also the Newport Bay Surgery Center.
Yep. Very
Good to have you on.
Very nice.
And
Thank you
nice
so
to
much
meet
for
you.
having me.
All right.
It was nice to meet you.
You take care, and
All right.
folks, we'll be right back.
All right.